Good morning, doctors. On behalf of Indian Dental Association, this is N.K. Prasad welcoming you all for today's webinar, part 5 out of 7 series. Today's topic, OSHA Bloodborne Pathogens and Aerosol Transmitted Diseases Compliance Training. I'm very happy to introduce the speaker for today, Mr. Eiman Rahmani. He's the CEO of Safety Compliance Experts. They have worked with over 2,000 dental offices, consulting and implementing OSHA and HIPAA guidelines in safety compliance. In addition, Mr. Rahmani consults Viva Concepts, a full-service marketing company. They consult on client management as well as company's design department. This includes creation of branding, individualized materials, and other promotional items for offices. I would like to thank our sponsors, Synergy Specialist Darius and RF America, Jesse Pulido. Thanks a lot. A very big thanks from our association. Without further delay, Mr. Rahmani, all yours, gentlemen.
Well, good morning, everyone. Thank you so much for being here. Very excited on a Sunday morning to talk about OSHA and bloodborne pathogens. Thank you so much for the introduction. Basically, there's nothing more for me to say. I'm going to go over in different sections on different things. So the first, I'm going to cover bloodborne pathogens, which I'm sure you all been through many times. Once that's done, I'm going to go over the new regulations that Cal OSHA has, which is aerosol transmittable diseases. I'm sure you haven't heard that before. Then after that's done, I'm going to go over some 2020 OSHA updates. What does it mean? Go over some stuff that has changed in the last 5-6 years to kind of give you an update. A little bit of background about us. What we do is basically our clients, we go in, we make sure they're in full compliance. So I've been personally to more than 2,000, 3,000 dental offices all over the United States. I know what goes on in a lot of dental offices, what are the major violations, what things needs to be improved. So while I'm doing this, if you have any questions, if I tell you anything it was other than what you've heard before, please ask. This is for you. I want to make sure that you guys be able to apply everything I'm going over with you today. So let's start. All right. So first I'm going to go over some definitions with you. We're going to talk about some basic bloodborne diseases. We're going to talk about personal protective equipment and safe work practices, exposure prevention, aerosol transmittable diseases. Then after that, I'm going to go over some updates regarding OSHA. That's when I'm going to talk about the pandemic. What do you guys need to do? What are the signs you have to put up? All these kind of stuff. So as I'm doing this, you are more than welcome to ask any questions. So the final product of any training is application of what was learned. So we all went to school, we've studied many books, attended many lectures. Unfortunately, I feel like the education system today has put people in a position that you study something, you learn something, you listen to a lecture, and you just completely forget about it. My generation and the today's generation, that's what goes on. People read a lot of books, they go to school, and then what they try to teach people is that you study something, get a grade, and then you're done. My goal, which I've delivered over 3,000 of these lectures, is that really help you in such a way that you can apply what I'm telling you. Rather than trying to make myself look smart and telling you all these regulations, all these things, my goal really is application. So let's discuss that together. I know it's a little hard. We're doing it virtually. I'm always used to doing this in front of the crowd. But let's talk about it. Let's discuss it. This is for you. My goal is for you to be able to apply everything I'm going over. And then hopefully by the end of this, you have a program that you could go back to your office and apply everything as you want. All right, there we go. So obviously, bloodborne are things that are carried through blood. Pathogens are viruses, bacteria that we're going to specifically discuss. When we use the word exposure as a condition of being in contact with pathogens, mainly exposure, bloodborne. So we're specifically talking about bloodborne viruses. So the first 20 minutes of the talk, we're strictly talking about bloodborne pathogens. I will not be talking about the pandemic or anything like that, but I will discuss that after bloodborne pathogens is over. So what are bloodborne pathogens? Bloodborne pathogens are viruses that you can catch through contact with human blood. There are three main ones, as you know, is HIV, hepatitis B, and hepatitis C. I will be talking to you in detail about each one of these things and then giving you all the updates that you need to know. So HIV, as you know, is a virus that leads to AIDS. What HIV does, it depletes your immune system. HIV virus itself actually doesn't kill its host. It's basically the lower immune system that kills the host. One thing that's actually really good about HIV, it does not survive well outside of your body. So as soon as it meets with oxygen, it dies instantly. Another good thing about this virus, I don't know how many of you have heard, if you remember 20, 30 years ago when you had a patient that had HIV, everybody would freak out. They would double gloves, double masks, double gowns. Everybody would basically use more precautions to protect themselves. It wasn't really needed, but because it was, if you actually got in contact with their blood and it would go into your system, it was a 90% chance that you would actually get the HIV virus. However, there are some medications that whoever has HIV, if they're on it, it's called a cocktail. If they're on the daily cocktail, they're taking it, the chance of them giving you the virus is a lot lower. So rather than 90%, it's around 20 to 30%. So it's a lot safer to have these type of patients. Either way, you guys you're following universal precautions. You're going to treat everybody as though they have all these diseases anyways. But just to let you know, I just want to keep you updated on what goes on and what's going on. Okay, this virus can exist in saliva, tear, and sweat. So anything that exits human body can contain these viruses. Symptoms, not that you're going to worry about it. Just be familiar with it. There's cough, fatigue, abdominal pain, loss of appetite. You get random infections that seem to not to go away. And one of the main ones that all these viruses have in common is severe unintentional weight loss. So if you see anyone, you have any friends or anyone that you know that you see them after 2 months or something, and you see that they have a lot of unintentional weight loss, you might want to tell them to go get tested. So that's one of the main things that you want to go over. Let's talk about hepatitis virus. So hepatitis B, Hep B, or hepatitis virus itself is a very tough virus to kill. It can survive outside of your body in dry blood up to 2 weeks. So it is very tough. It's one of those toughest viruses to basically deal with. This is the reason you disinfect, you clean, you autoclave, whatever it is that you do. This is to deal with this specific virus. And I know usually people ask me sometimes when I go to people's offices, whatever that you're using that kills Hep B can kill COVID-19 and coronavirus. Okay, so just so you know, what this virus does, it basically attacks your liver. Hep B itself doesn't necessarily kill you. You know, there was a lot of people in the past that before the vaccines, caught it. There's not much. You get immunity towards it, so your body can fight it. But just, it's one of those bloodbornes that you want to be careful. Vaccines are available since 1982. Be familiar with the symptoms: jaundice, fatigue, abdominal pain, loss of appetite, intermediate nausea and vomiting. Not that you're going to get anything, but just be familiar with it. Okay. Let's talk about the vaccination. So the Hep B vaccinations are strongly endorsed in medical communities. So if you have an employee who has never been vaccinated before, it is your responsibility to make sure that you offer to them for them to go get tested. I'm going to talk about that in detail in the next slide, but I just wanted to bring it up. So vaccines are completely safe. I have a newborn, he's a month old. So when we were in the hospital, the first thing they say, hey, we're going to give him Hep B vaccination. So it's apparently completely safe. I got it when I was 7 years old, so things are changing. it needs to be offered to all the potential employees within 10 days. So what does that mean? So if you hire anyone that's going to be in the back, helping you, assisting, cleaning, sterilizing, they obviously need to be vaccinated if they want to be vaccinated. You know, it's not a mandatory thing. It's not mandatory yet, but people say it's not mandatory, but you can't go to school in the US if you don't have the vaccinations done. So it's kind of like interesting. So most people you hire right now, in the last 10 years, based on my experience, most people you hire, they already have their vaccinations. So if they do have their vaccinations, you want everybody's vaccination records in hand in your OSHA manuals. So let's say you don't have OSHA manuals, you can purchase them from, there's a lot of different OSHA manuals. So there's a chapter in there that you just want to keep everything in there. If you don't have OSHA manuals, you don't know, whatever, it's not a big deal. I mean, you need it, but just have it handy somewhere that you can have full access to hepatitis B vaccination records of every staff member. So do your front office staff need to have Hep B vaccinations done? Well, the answer to that question is, do you ever have the front office go in the back and assist you clean if things get crazy, your assistant doesn't show up? Do you ever get your front office staff to assist you, if it's even once in a million years? If the answer is yes, then yes, they need to go through the same training I'm going over with you today. And also you need to have their Hep B vaccination records at hand, okay? So there's this form, there's a consent and declination form. This is a form that we have for our clients. Thank you for making my camera smaller. I was going to do that. I appreciate it. So what it is basically, so for staff members that you hire that never had the vaccinations done, you need to offer them, and you need to have a record that you offered for them to go get it done. Obviously, if they've had it done before, all they need to do to bring you the record, so you don't need to have them sign this form. So if you, let's say you hire me, I've never had it done. You have 10 days to offer it to me. You give me this form. Either I say yes, so I'm going to consent to it, or I say no, you know what, for religious whatever, you know, my religion, you know, figuratively, let's say I don't want to get vaccinations done, so I'm going to decline. You keep this declination form at hand to, in case you get audited by OSHA, it shows that you did your due diligence, okay? So there's this thing called a titer test. What a titer test is, it checks to see if you still have the immune bodies in your body. So a lot of us have had this vaccines done more than 10, 15, 20 years ago. If you guys remember, about 10, 15 years ago, we used to say every 10 years you should go get a titer test. Things have changed. You know, so now they say it's either good for a lifetime, or some people say 20 years. So I'm more conservative. I say, let's just go with the 20-year thing. So if you've had your vaccinations done more than 20 years ago, you're a doctor, you're a hygienist, you're an assistant, it's not a bad idea when you go to your yearly checkups, you do yearly blood tests. It is not a bad idea to go and include a titer test in there. It's not expensive. It's a good idea to go get it done. The titer test itself is not the responsibility of the practice. So as the owner doctor, you're not responsible to pay for that. Your employees are responsible to do that. Most of them have insurance. Their insurance cover a titer test. It's not a big deal. Okay, so if the titer test comes back negative, there's this thing called a booster shot. So the vaccine itself is a 3-series vaccine. If you guys remember, I don't know if you guys remember, it's just very painful. It's not fun. So it's the 3-series vaccine. But if you need a booster shot, if your immune bodies is not enough, they usually give you one shot. It's called a booster shot. So if you do have an employee that their titer test comes back negative or positive or whatever it is, and their physician says that they need to do a booster shot, the booster shot is the responsibility of the practice, so you just have to pay for it. It's not expensive, 20, 30, 40 bucks, depending on where you go. You can go to clinics that, they offer it to you very, very cheaply. Sometimes their insurance covers it. However, keep in mind, sometimes their physician might say they need a booster shot or they need the 3-series again. So whatever it is that their physician recommends for them to do, you have to cover that and you have to pay for it. And then once they get the documentations that their immunity is fine, you get those new documentations and you also keep that in your records, okay? Now let's talk about Hep C. Believe it or not, hepatitis C is the most common bloodborne infection in the United States. The reason for that is that obviously early chronic infections have no symptoms. You can have it for 2, 3 years, 4 years, 5 years, and show no symptoms, and you're totally fine. So that's one of the reasons. Also, in the 60s and the 70s, a lot of people were having a lot of fun. Obviously, they had it. They didn't know, so they gave it to other people. Another reason for this was there was never a cure. You get it. You had to live with it for the rest of your life. About 10, 15 years ago, they came up with a medication, I don't know the name, that actually slows down the progress of this virus in your body, of it attacking your liver. About 2 years ago, they came up with a cure. So the cure is you take this medication for 6 months to a year. It's very expensive, but you take it, it eradicates the virus completely out of your system. So that's good news. So we're pretty much down 2 viruses. So Hep C, you have cure. Hep B, you have vaccination. And HIV, which I went over earlier with you. If they're on their cocktail, the chance of them transmitting the virus to you is a lot lower than what it is before. So that's actually good news. What the Hep C does to your body, it attacks your liver. Eventually, you get liver failure, liver cancer, and it could kill its host. A lot of times it don't because you have all these things. Be familiar with the symptoms: jaundice, fatigue, abdominal pain, loss of appetite, intermediate nausea, and vomiting. All right. So there's this thing called other potentially infectious materials, OPIMs. It's all over our OSHA manuals. So what it is basically other places or other things that you can catch these viruses I just went over with you. Saliva, vomit, urine. Okay. So there's also skin tissues when you guys do surgeries, extractions, stem cells, Botox, whatever it is that everybody does these days. So anything that exits human body can contain these viruses. So you want to make sure that you're protected. Always wear proper personal protective equipment when you are dealing with these type of stuff. So there's this thing called Bloodborne Pathogen Standard. So I'm sure you're all very familiar with it. It's been around for more than 25 to 30 years. It is basically everything I'm going over with you right now. You have to have a copy of Bloodborne Pathogen Standard in your practice for your employees. So that is part of your OSHA manual. Okay. People need to be familiar with it, and everybody needs to know. So let's say you have OSHA manuals. Your OSHA manuals, everybody needs to know where they're located. So now that we're talking about OSHA manuals, there's this misconception about OSHA manuals that I just want to go over to kind of help you with it, because sometimes buying OSHA manuals from American Dental Association or California Dental Association can be more of a liability. And the reason it's a liability is because these manuals need to be customized. If you actually go and open them up, there's a lot of blanks that you need to fill out. So you need to customize this for yourself. So if you have an office manager, just tell them to go do that. Another liability with having OSHA manuals is you need to get them and buy them once a year. So they need to be updated annually. So it's just every year you have to update them, fill them out. Just make sure it's customized for your practice. There's a lot of things because the manuals you guys buy, which is totally fine, they're very generic. They're designed for practices with 2 operatories and 2 employees, all the way up to clinics with 100 operatories and over 100 employees. So they need to be customized. Okay. So just one thing I wanted to go over with you, just things I see that when I go to the offices to do that. Obviously our clients, we customize it for them, but just I want to make sure that you do that if you decide to purchase OSHA manuals to just kind of help you out with that. How else can you catch these viruses? Obviously, if your blood gets in contact with someone else's blood, you can catch these viruses. If someone else's blood goes into your mucous membranes, which is your eyes, your nose, your mouth, okay, which is very important. This is the reason it's very important. So back like 20 years ago when I started this, the old timers, I used to beg them, I'm like, can you please wear gloves? Or can you please wear masks? Now I'm like begging people, I'm like, please, can you wear your, cover your eyes? Can you wear goggles and things like that? So because I know you already know, but I go over it because sometimes when there are people, they're like, oh, I didn't know that. You know, the fastest way to get anything into your system and your body is to either put it in your eyes, your nose, your mouth. Okay, so that's why you always want to have your mouth covered, your eyes covered, you know, to protect yourself. And there's one more thing you can learn from this pandemic. Hopefully, it goes away very soon. But if you learn to get in the habit of not touching your eyes, your nose, your mouth, you're going to lower the chances of you catching any virus, whether it's COVID-19, a common cold, influenza, flu, because most of us get it because we're just used to touching our face and nose. You know, we're rubbing our eyes. You know, you want to sneeze, you're holding your nose, or you're like biting on your nails. So just get in the habit of not doing that. It would be really good. Or if you have a non-intact skin. So once they open up the hair and the nail salons and you guys go get your nails done, mainly speaking about girls. I mean, if you're a guy, you want to get it done, good for you. So they usually cut your nails and a little bit of your skin. So that's considered non-intact skin. So you want to make sure you always wear gloves when you go to contaminated areas. So the definition of a contaminated area is your operatories, your sterilization room, your laboratory, anywhere that you would see patients, x-ray room, you know, if you have a pan room, you take patients there. These are all contaminated rooms. Wherever you go, you need to wear your personal protective equipment. Obviously, if you get contact with contaminated sharps or needles, yeah, you can catch these viruses. All right. I'm just gonna, if you can move my, get perfect. Thank you. You need to have in your practice this thing called a biological spill kit. A biological spill kit is a kit that has everything you need. There's a special powder in there or whatever, anything you need to clean, you know, vomit, urine, a lot of blood spill and things like that. You're never going to use it. Hopefully, you know, knock on wood, you never need to use it. You just have to have it. It's not a recommendation. It is a mandatory thing. You have to have a biological spill kit. You can buy them from your suppliers. They're not expensive. You don't have to buy the $200 version of it. Just buy the $70, $80. Patterson has it. All the suppliers have it. Once you get it, it never expires. You're good to go. Just make sure. Yeah, if you have any questions, just post. I'm looking at the chat as we go. So if you see me looking around, I'm looking at the chat to catch any questions. So let's say you don't have a biological spill kit handy. You can create your own kit. So also, just so you know, you can create your own biological spill kit. You don't have to buy one. So it needs to have gloves, a disposable lab coat, rags to clean things with, a little bit of a bleach. So solution of bleach and water. You can put some Cavicide, whatever it is that clean stuff. Goggles, red bags. You put them in the kit. You label it biological spill kit. You know, let's say you don't have it and you have an emergency. Somebody falls down, there's a lot of blood, whatever it is. You can use a solution of bleach and water, 10 cups of water with 1 cup of bleach. You dilute it, you spray it on whatever you need to do. If you feel like you want to be safe, you can just pour bleach on it. Bleach kills everything, so bleach is really good. Just so you know, it's a really good disinfectant. Everybody has bleach. So you can use bleach. If you want to use Cavicide, you can. Cavicide is good too. Personally, bleach is cheaper, easier to do. Just have a, you know, 1 gallon of bleach at your practice just in case there's an emergency. But again, I want to reiterate, you need to have a biological spill kit. Okay. Back in the day when you guys used to have fixer and developers, remember those good old days? If you still do that, if you still have fixer and developer, even if you don't use it, you still have the chemical. If you don't use it, you have the chemical, please have them removed. It's not very good to have it. One recommendation I have for you. Another thing, if you still use fixer and developer for whatever, because you have the old machines, you need a chemical spill kit. So you get a chemical spill kit. If you use mercury, you know, fillings and things like that, then you need mercury spill kit. So there are 3 spill kits you have to have. Biological spill kit, mercury spill kit if you do any kind of mercury fillings and things like that. And then if you have fixer and developer, you need to have a chemical spill kit. These are the things that they come and look for. If you have them, make sure everybody knows where they are. Sometimes people have it because I find them and then I ask them, do you have it? They're like, well, I don't even know what it is. I'm like, well, you have it in your laboratory all the way on the top. So you just need to make sure everybody knows where the things are located. Good. So you have this thing called exposure control plan. What an exposure control plan is part of your Bloodborne Pathogen Standard. Bloodborne Pathogen Exposure Control Plan has been around for over 30 years. What it is what are the things that OSHA wants you to do to prevent you, yourself, and your staff from getting an exposure. So in 2016, OSHA came up with another exposure control plan, which I'm going to go over in detail later, called Aerosol Transmittable Diseases Exposure Control Plan. So now you have two exposure control plans, okay? I'm going to go over that in detail. It talks about what to do when there's a pandemic, what to do during flu season. I'm going to go over that in detail with you so you don't have to worry about it. So, but I just want to make sure, because I'm going to talk about exposure control plan. I don't want you guys to get confused. People confuse it because it's a new thing. So you have Bloodborne Pathogen Exposure Control Plan, which I'm going over with you right now. It needs to be reviewed and updated annually. So when you update, that's why I tell you need to buy OSHA manuals once a year. So because you need to update it. And you have to have credentials to update these things. So what we do for our clients, we update it for them, and writing. Everything needs to be in writing. OSHA is like IRS. So they love things in writing. You know how you have to have your receipts and papers, everything for IRS. God forbid if you ever have an audit. It's the same thing with OSHA. Everything needs to be in writing, signed, paperwork, keep it forever for 10,000 years. Right, so that's the same thing you do with OSHA. So it needs to be reviewed, updated annually, needs to be done in writing. You have to ask your employees for their input. That's something we usually do. But if you have your quarterly meetings with your staff, which I don't think anybody does, but you can ask for their inputs. You need to reflect any technological changes. So, excuse me. Here's the thing that no one does. You guys have to use safety needles. Safety needles are the ones that they recap themselves. There's a picture down below of a safety needle. So dentists will never use it. And the reason, oh, that was a question I missed. So so would you customize OSHA manuals for your office? Usually how much would it cost? So I don't want to get into, because I don't want to necessarily promote our services, but I'll answer that question. We provide a service that includes everything. So our OSHA manuals are included in our program. So we do on-site OSHA inspection. We run it through all the checklists. So we do everything that you need to do in terms of OSHA. We give you all the signs, symbols. We deliver the training that I'm going with you over today with all your staff. Train all your staff. Give you 3 OSHA manuals that you need, which is safety data sheet, a records manual, and the OSHA manual with all the regulations. It's included in our package. If you are curious about how much it is, what our services cost, just ask me later at the end or whatever. I'll give you my number. You can call me. Honestly, I'm just here to help out. I'm not interested in promoting our service. But if you have a question, you want to know what it is, just ask away. I'm transparent. I can ask any questions. We're not at all expensive. We're anything. So anyways, safety needles. So let me see if I can actually pull, because now that you guys are asking. So there's this form you have to fill out for safety needles. So you're not going to want to use safety needles. And the reason you don't want to use safety needles is because it's not going to fit your instruments. However, OSHA doesn't care. So there's this paperwork that you need to fill out. And I know it's not going to fit in the screen, but I'll just show you kind of get an idea of how simple it is. You have this form that you give. Don't worry about what it says. It just basically, this is what you give to your employees in the back. That basically says they know and they understand that you're not using safety needles, okay? And then you have this other form, which I'm sure you've seen before. It's a survey form that basically you try safety needles, like any brand, it doesn't matter. You answer the questions. Most of them are going to be either one or not applicable, which makes it more dangerous. So using this sheet, you basically prove to OSHA that this is more dangerous to use safety needles in a dental field than it is safe. then it allows you to legally waive using safety needles. I'm sure you've heard of this, but probably never really did anything about it. There's things you can do. So there's that form that you can fill out that allows you to do that. If you have questions, just ask. So I'm just going to move on to the next thing. So how do you have potential exposure determination, safe work practices, how to decontaminate equipment, personal protective equipment, handling biowaste. Again, all these things that I'm going over with you today right now is everything that is included in your OSHA manuals, which you need to have. So who must be trained on bloodborne pathogens? So whoever is around blood or other potentially infectious materials needs to be trained on this training. So for example, your assistant, your hygienist, your back office staff, if you have receptionists that would ever go in the back to clean, disinfect anything, they would need to be trained too. So our clients, honestly, when I go in their office, I train everybody. So everybody needs to come get trained because it's easier to get everybody on the same page. Because there's a lot of cross-contamination. People like the dentist likes to come in the front, walk the patient in the front, have them, do the charts in the front or go in their office, while you're wearing your personal protective equipment. That's considered cross-contamination. So you don't want to do that. You're not supposed to do that. So because of that, I train everybody so I can have the front office kind of like be the police for that. Oh, I actually don't know. I can look it up right now. It's the medication cure. It says here. I'm gonna type it in here for you. It's called Harvoni. So there's different ways that you do that. Okay. And then obviously, so back to this thing, if you have anyone who's trained in CPR and first aid, you can basically go through this training. If you can move me up, that would be great. So this is an important slide. So I'm going to spend a lot of time on this because this is where I go over some of the major things that I see in the dental office that people do. So if you want to take notes down, you're more than welcome. So obviously you want to be aware of the risk around you. So the doctor is usually the one that you want to be the one, which you're going to hate me forever, but you're supposed to be the one that disposes of the needles. So because you're not using safety needles, so what you want to do, if you want your staff to do it, always make sure you recap using scoop method, so they're not minimizing, the chance of them having an exposure. So that's very important to do. And then another thing is 80% of our clients, when they report their injuries, happens in the sterilization area because their staff just don't wear puncture-resistant nitrile gloves. So you need to wear these annoying thick, gloves, which that picture is illustrating it really well. Staff don't like wearing it because they're bulky, they're uncomfortable, but because of them not doing that, they actually poke them. Your instruments are very sharp, so they poke themselves. So, then you have an exposure incident, and it's actually a lot worse to have an exposure incident in the sterilization room because you don't know whose instruments it was that you just poked yourself with. So then you have a major issue. Okay, so just so you know, having an exposure in a dental office or a medical office is not acceptable. Like OSHA doesn't like it at all. That's why you're not reporting your OSHA form 300 and 300A because they don't even want to have any exposures. So, so you don't have, back in the, 30 years ago, I don't know how many of you have been in practice for that long. Back in the day, you used to have to report your injuries to OSHA. So they don't even want to do that because you're exempt for that because one, your practice is so small. Also, you're not supposed to have any exposures to begin with. You know what I mean? So if you do that, they're going to be like, oh, we should go and do an inspection. Another thing is how you pay attention how you dispose of your sharps. 80%, 90% of the offices when I go in for the first time or when we go in for the first time, they have their sharps container in their sterilization room, and they're disposing of the sharps in the sterilization room, please don't do that. That is a $5,000 per operatory violation that you can have. It's up to 5, I mean. So, you know, if you have 4 operatories, that could be up to $20,000 violation. So get sharps containers, put them in every operatory and dispose of it there, and get rid of the one in your sterilization room and your laboratory. The reason for that is because the law says you need to dispose of sharps and needles in the place that you are giving an injection. So if you have an ortho station, so an ortho station is a little bit different because obviously you have chairs right next to each other. You may or may not have a room. So the way we do it is you have a 12 feet leeway on how this regulation works. So you can have, let's say, a little station in the middle. You have an operatory here. You have an operatory there. You can have your sharps container in the middle, in between, in a little cabinet. You can do that. It needs to be properly signed. You know, signage needs to be there on the cabinet. Or if you have an ortho station, you can have, you know, sometimes you have a little cabinet that you use for all of them. Just have it in there, okay? Keep in mind, ortho wires are considered sharp, okay? So you need to put them in a sharps container. Another thing that I tell people that could save you some money is that carpals. You can throw away your carpals in trash. So here's the reason most people put them in a sharps container, because a lot of times you have a little bit of the Novocaine left. So when you throw it away in a sharps container with the Novocaine, that's actually illegal. You're not supposed to put medication or pharmaceuticals, expired pharmaceuticals in your sharps containers, because this is the reason. What they do, they autoclave the sharps containers and then they landfill them. So in case they ever leak, you have the medication in there, right? The autoclave doesn't kill the Novocaine, right? So then you're going to have a major spill and you're going to have a disaster. So that's an environmental hazard. So what you want to do it correctly and not get in trouble, is whenever you're done, you don't need a Novocaine anymore. Squirt it in your tray. You're done. You can get a little gauze if you want to be fully done, like squirt it on the gauze, right? Take your carpal out. You can throw it in trash. If it breaks, sometimes you're taking it out. A lot of times it breaks. It's up to you if you want to put it in a sharps container or you want to put it in trash. Some people say, well, it's sharp. It's sharp. I'm like, okay, good. If you have glass and it breaks, where do you put it? Would you put it in a sharps container? No, you put it in regular trash. So some also say that argue that it has blood on it. I'm like, okay, good. What do you do with your bloody gauze? You throw them away in your regular trash can, as long as they're not dripping blood, right? So if it's soaked blood, it's absorbed blood, you can just put them in a regular trash can. So it's the same thing with your carpal. So hopefully you do that. That saves you a little bit of money. Okay, so that's something you can do. But make sure you squirt out all the Novocaine. So you have this thing called universal precautions. So universal precautions is treating all human bodies and fluids as though they have the deadliest diseases. So that's universal precautions, and then you properly clean and disinfect the equipment. I think there's a question. So there's a question, is a since I heard that in Orange County, carpals without blood can go in trash. Yeah, that's exactly what it, but not with Novocaine. You are not, so in a business, you cannot dispose of pharmaceuticals in your regular trash. So if you have expired pharmaceuticals, you cannot throw them in trash can. A lot of times people do that I've seen it done or asked questions. So squirt the Novocaine out, throw it in trash. Whether it's in Orange County, in New York, or in Moon, that's the regulation. There is no mandatory regulation, because it's trash. It's just glass and a little bit of plastic on the top. So you can just throw it away in trash. A lot of people, the reason they put it in the sharps container is because there's Novocaine in it, and they think, obviously they know they're not supposed to throw it away in trash, so they throw away in the sharps container, but you're not supposed to do that. And then also, a lot of medical waste companies want you to do that, because then they have to pick up your waste more often, so they make more money. So they make money per pickup. So That's one thing. So that you could, if you stop doing that, your pickups will go down by probably 40 to 50%. So you can save, you know, $500 a month or something, you know, with your waste. If I answer your question, you know, if I didn't, just ask it in a different way. Okay. So universal precautions. This is the funny slide. I like it to be a funny slide because when the pandemic hit, they shut down all the medical offices and the dental offices. It was kind of funny to me because I'm like, we treat everybody as though they have coronavirus and you know all these kind of viruses anyway. So why we have to shut down? So it just kind of didn't make sense. But you have universal precautions. You know, you just follow it. You treat everybody as though they have deadliest disease and really bad infections. Mandatory personal protective equipment. This is not a recommendation. This is a mandatory thing that you guys need to follow. You have to have goggles or face shields. Personally, I like face shields, especially the one I posted. It needs to hit your head, cover the top, so aerosols don't travel over and go inside. Those are really good. You can wear goggles as long as it covers your eyes. A lot of you guys wear glasses. Glasses are not considered eye protection, so please don't do that. Masks. You have to have masks on. Please don't use level 1 masks. We're not talking about pandemic time that you're wearing N95 and you're wearing a level 1 mask over it. That's not what I'm talking about. In a dental office, you have a lot of aerosols. You need to use level 2, level 3, okay, depending on the surgery and what you're doing. So do not use level 1. I don't even know why I'm supposed to go over this in trainings, but I've noticed that a lot of doctors do this because it's cheaper. Don't do it. You can get a little tiny bit of a situation with it, okay? Wear gloves, obviously, when you're cleaning, disinfecting, treating patients, always, even when you do ortho. Sometimes I've seen people, when I do inspections, the orthodontist feels like they don't need to wear their gloves. Okay, good. So there's a question. It says, I'm not clear about disposing carpals in sharps container or trash. You do not need to dispose of your carpals in your sharps container. Okay? However, you cannot throw them away in trash if there is Novocaine left in it. So what you need to do, you need to squirt it out, okay? And then throw it in a regular trash. Is that clear? Just let me know if it wasn't clear. I can explain it different ways. I know it's a little confusing because it's not something anyone would tell you. So anyways, if it's not clear, let me know. I would be more than happy to explain it. It's no problem. I think it would help you out. You help you guys in a long run, saving you guys money. Lab coats. You can use disposable lab coats if you want, or you can use regular lab coats that you laundry yourself or send it to the laundry. It doesn't matter. So disposable lab coats, and my pleasure. I'm glad I was able to answer your question. Disposable lab coats, you don't have to change it after every patient. There's there's recommendations that they say after every patient, because there's a lot of aerosols, you should change it. You know, back in the day when you had regular lab coats that you would laundry, you would wear it all day, you know? So it's the same thing, same concept. Just so you know, don't let anyone tell you anything different, because it's their recommendation. The recommendation is dispose of the lab coat after every use. I don't think it's going to happen, so I would go over that. Where do you dispose of your personal protective equipment? It needs to go in a trash can in your contaminated rooms. You cannot dispose of your lab coats or your gloves, which happens all the time, in your office, in the reception area, in the waiting room, in the bathroom. These are all clean rooms. The way OSHA wants you to do it, or Department of Health, you're done treating the patient, you take off your gloves, wash your hands for 20 seconds with soap and water, exit the room, and then go when you want to see the patient, you wear your gloves again. So I've seen it, you know, disposed all over the place. Don't have trash cans outside of your office, you know, thinking it's outside of your office in the hallway, you could throw it away. No, you need to dispose of your gloves in the room when you're done treating a patient. So what do you do with regulated medical waste? This is red bags, okay? So if you have liquid or semi-liquid blood or other potential materials, they can go in the red bag. So there's another question. It says, how long can I wear N95 masks? I'm going to go over those, but I'm going to answer you since you just brought it up, so you don't have attention on that. So there's a shortage of N95 masks. So there is ways you could do it. You can wear, switch one every 5 days. So you can create a little container with holes in it so it can air. You would label one for Monday, Tuesday, Wednesday, Thursday, Friday, or wherever it is that you practice. So Monday, you would wear an N95 mask. You can wear a level 1 mask over it to just protect it because you're going to reuse it all day. And then Monday, you're done. You take it off. You put it in this container. You let it sit somewhere clean for it to air and you know, all the viruses would die. Next day comes, you use the Tuesday one. So you can actually reuse it as many times as you want because there's a shortage. As soon as the shortage is done, you can get more N95 masks. You basically can just wear them all day, throw them away. When the pandemic is over, there is no shortage. Right now, it's not mandatory for dental and medical offices to have respiratory protection program. So if you have to, if in case laws change, you have to have a respiratory protection program. As part of that, you need to have N95 masks. And when you're treating patients, they want you to wear N95 masks. When the pandemic is over, and hopefully not, and I'm hoping that they wouldn't do this, if they require you to wear N95 masks to treat every patient, you need to dispose of your N95 masks after every patient, okay? They haven't done that, but for now, during a pandemic, you could use it all day, cover it with a level 1 mask, and then let her air for 5 days. Some people do it for 3 days. You know, it's up to you. Some people use UV over it and things like that. You can do whatever you want to do. I'm a fan of like 5 days. So you let 5 days by, and then you can basically go back and do it. Don't store it in your office. Don't store it in places that are clean. Put them in the sterilization room. Clean out a cabinet area that you have. Just keep one for everybody. All your staff needs to wear it. Another thing with N95 mask is, which no one does, you actually need to get initially fit tested. So initial fit testing never got canceled. The yearly fit testing got canceled. The initial fit testing never got canceled. So the reason you need to do fit testing for N95 masks is that every face is different. There are many different kinds of N95 masks. They fit test to see which one fits your face better. And then whatever fits you, that's the one that you're going to basically use, okay? I hope I was able to answer your question. So, red bags. So liquid or semi-liquid blood or other potentially infectious materials needs to go in a red bag. So in a dental office, you do not need a red bag. The reason is you don't have a lot of soaked blood. Unless you're an oral surgeon, you do a lot of surgeries and there's a lot of blood. Even with that, there's ways you could go around it. So if you have gauze that if you squeeze, blood would drip off, sandwich it between 2 other gauzes, okay, you're good to go. All right? So you don't have to worry about that. Then you don't need red bags. Saves you $300 a month worth of a pickup. Okay? Obviously, contaminated sharps goes in a sharps container. When we have a client, we place biohazard symbols on all your trash cans where they're contaminated. So that's why we have it here. So this is an indication to show that there's a biohazard in there because there is blood. That doesn't mean you have to have red bags in them. It's just an indication for your staff. This is a biohazard symbol. Wherever you see this symbol, you need to wear proper personal protective equipment, meaning gloves, goggles, masks, lab coats. It is on your red bags. It is on your sharps containers. Anywhere you keep other potential infectious materials. So just be familiar with it. The color is usually red or orange. Depends. It's not yellow. I don't know why sometimes I go to people's offices, they're yellow. I have no idea. I'm going to take a sip of. Do I have any questions? Because I'm going to get into a little bit of a complex subject. I want to make sure we're good. Ask me if you have any questions. So now let's talk about what to do when there's an exposure. So an exposure is someone else's blood or other potentially infectious materials gets in contact with your blood or other your mucous membranes. So if you do have that, the first thing you do, you wash the infected area with soap and water. You don't need to, stick it in bleach. You don't need to suck on it. It's just wash it with soap and water. You're good to go. And then let the office manager or the doctor know. So this is your protocol in your office. This needs to be a protocol in writing. That's something we provide for our clients. Just make sure you have it in writing. Everybody needs to know. This is not a recommendation. This is a OSHA protocol that is in place in all the offices. Wash with soap and water. Let the office manager know. Go to a doctor or a clinic within 2 hours. My recommendation is don't go to a hospital. It's too busy, too crazy. They're not going to pay attention to you. Just go to a clinic or a regular doctor. They know exactly what to do. Then what the office manager needs to do is basically they would give you your Hep B vaccination records to take with you. The reason for this has been when the doctor is going to see you, they need to know how long ago you got your Hep B vaccination. So if it's been 20 years, they might give you a booster shot right there before even your blood results come back. Sometimes they give you the 3 series, so it depends on this. That's why it's important to have everybody's vaccination records at hand. And they usually give you, technically, you're supposed to give them that Bloodborne Pathogen Standard, copy, so for them to go and review. So most people don't do that, but that's just what they want to do. And then what the office manager or the doctor needs to do, obviously you need to document that there was an exposure. There are specific forms you need to fill out. Then you need to identify the source. Who was it that employee got exposed to their blood? Was it another employee? Was it the doctor? Was it the patient? Ask that individual to go get tested. Let's say it's a patient. Pull the patient in a room and say, hey, one of our staff just got exposed to your blood. Would you mind if you go get tested? Keep in mind that they could refuse. So you might want to be very nice with them, very courteous with them, offer to them for them to go get tested, cover any expenses or anything like that. Then there's some forms you need to fill out. There's you need to have an opinion of healthcare provider given to the medical doctor for them to fill out what it is that they recommend for the employee to do. And then if you ever get the test results back from the patient, you have 15 days to give the results to your employee. Okay, so there's like time dates. That's why, like, when you have an exposure, it's like everything is like 15 days, 10 days. You have 10 days to do this, 2 hours to do this. So that's why you want to make sure you don't have any exposure. Then there's all these forms you need to fill out. There's a Sharps injury form, exposure incident form, accident investigation, and all these kind of stuff. So it's a lot easier for you not to have an exposure, so you don't have to deal with it. So, and then you need to keep these records for over 30 years. So medical records are kept for 30 years. All of our forms are HIPAA compliant. So you just also want to make sure you keep that in mind. You want to not violate HIPAA and write patient's name, any information on there. So, and have everybody have access to it. Okay, now, I am done with bloodborne pathogens. Now I'm going to talk about aerosol transmittable diseases. This is a new regulation. I don't think anybody has heard these things. It's very simple. I'm going to tell you exactly what you need to do. So if you have any questions on Bloodborne Pathogen Standard, this is the time to ask. I'm going to give you 3 seconds. If you have anything, I want to drink a sip of water. Then I'm going to get into the exciting stuff. Perfect. No question. So what are aerosol transmittable diseases? There are viruses that you can catch through air or droplets, such as influenza, COVID, right? These are some flu. These are all considered aerosol transmittable diseases. So a little background about this. In 2016, OSHA mandated medical and dental offices to prepare a specific protocol to deal with flu season spikes. So if you know, which I'm sure you know, thousands and hundreds and thousands of people die every year in the US and all over the world from flu. So for that reason, they want to kind of mitigate that and handle that. So they came up with this regulations, which I'm going to go over with you today, as to how to do this, and then also exact protocols in case there is a pandemic. So I've been doing this training for the last 4 years. Every time I did it, I kind of made a joke about it because I was like, oh, we're going to have a pandemic. So now the joke is on me. So no one believed I never in a million years thought something like this would come up, but all of our clients were prepared for it. So they were able to basically reopen after 2 weeks of shutting down. So it was pretty good for them. So the first type is airborne. The virus is just, be familiar with it, you know, just tuberculosis, which I'm going to talk about in detail, COVID-19, I'm going to go over with you, chickenpox, bird flu, smallpox, herpes, measles, these are all airborne. These are viruses that you just want to be careful with. Then the droplet ones are influenza, mumps, you know, SARS, you know, these are the things you just need to be familiar with. There's many different kinds. I don't want to list them here. So just, we all know what they are. So what does that mean for you? So what do you have to do? So we're going to put the pandemic aside. Okay, I'm going to go over what you need to do during a pandemic after this slide is done. I mean, the aerosol transmittable things are done. I'm going to tell you what call screenings, all these things. But when the pandemic is over, what do you need to do? Okay, so first, you need to have your office manager or somebody as an administrator to implement and make sure they re-implement this program. So what we do, we always have an OSHA coordinator. That's the person we always are in touch with, or safety coordinator. There needs to be written procedures and protocols as to how you're going to implement this program. So they need to be in writing. It's usually part of your OSHA manuals. So you need to just have it in writing and what the protocols are, and there needs to be specific training with all your staff. So I'm training you right now. You're going through the training right now. So all of our clients, once a year, we go back, we remind them on what things they need to do. And then you need to establish procedures for screening patients. So the call screening protocols and inpatient screening protocols need to be re-implemented. So when you're scheduling your patients or confirming their appointment, for next day, you need to do you have any flu symptoms? Do you have a temperature? You know, have you been around anybody who has flu? You know, do you have, you know, stomach pains? Whatever the flu symptoms are, which is temperature, loss of appetite, and also loss of sense of smell or taste. So you just have to ask all these questions during flu season. Flu season is considered through December to February. So I say we're going to re-implement this for all of our clients. They're mandated to do this from November through February of every year. We re-implement the call screening protocols for all their patients, and that's how we can lower the chance of them getting sick. Also, you need to obviously communicate the written protocols with all your employees as to what it is that you need to do, what it is they need to do, what's it's needed from them. And then establish whatever office to office is different, you know, how you can reduce the risk of getting, you know, people to come to your practice. So in a small office like yours, so this is how we customize the manuals for our clients. So for practice your size, you will not treat patients with aerosol transmittable diseases, okay? So it's different in some clinics. Like if you're a dental office clinic, whatever, you're big, you're large, they cannot refuse treatment. They have to see these people. So their protocols are different. So they have to have special air ventilation, air filtration, special rooms, all these kind of stuff. So you don't have, your facility is not equipped for these type of stuff. So your regulations, your rule will be you do not treat patients with COVID, influenza, or aerosol transmittable diseases. So if you have a patient who has a flu, you're going to reschedule. If there's an emergency, you send them somewhere else, okay? Unless you want to treat the patient yourself, and I'll tell you in the next slide what you would need to do if you ever need to treat that. So because of the call screening protocols, you will screen patients, and you will not treat anyone with flu or flu-like viruses or aerosol transmittable diseases. That's how you handle it. This is not a recommendation. These are mandatory things that you need to do. So we all have it implemented because of COVID, so you just continue doing it next year. So you have to have ample enough amount of N95 masks in your office, so you need to be fit tested for it. There are companies that come and fit test you. They charge you $75 per employee or so. It costs you around $100 per employee. You fit test, you find out what fits you best, what fits each employee. You buy a box of each just in case there's a pandemic, they decide they want to do this again, or, you have a patient that comes in that has the flu, whatever it is, and you feel like you need to treat them. If you need to treat them, you do the same thing you're doing for coronavirus. So you basically wear an N95 mask and you treat the patient, and then you fully disinfect that room. You need to make sure you minimize the amount of aerosol things that you generate. You can get these special suctions that are around. If you want to get that, you're more than welcome to buy those. So those suctions are a recommendation. There is so outside of the things that I go over in this training with you, or in my talk today as a whole, there are no other things that are mandatory. I don't go over things that are recommendation. I only go things in my slides that are mandatory. Okay, so just to go over that with you. So good. How to slow down the spread of flu. So flu season, according to CDC, is December through February of every year. I say it's November. Okay, so for our clients, we re-implement everything in November through February. Sometimes we even stretch it to, March. So flu shots are recommended if you want to get them. They're recommended. I think there is a question. I missed it. We still come across patients with history of COVID around more than a month or so. In such cases, what would you advise? So if you have someone that had COVID, and they're recovered, they're completely fine. After 2 weeks, it completely goes away. I mean, I had family members that got it. Nothing happened to them. We stayed home. I had a little bit of fatigue. That was one of the main ones. Like my aunt is like 85 years old. She got it for 2 weeks. After 2 weeks, it was fine. I mean, I visited her afterwards. I get tested once a week because I go into dental offices and stuff. So your main problem with COVID is going to be your employees. So I can talk about it right now. So you have to implement screenings for your employees as well, because God forbid if your employees get COVID from other employees during work, they're going to go to the doctor. The doctor has to ask them where they got this from and where they think they got it. So if they say from work, they have to report it to Department of Health. And you're going to get a call from a Department of Health. And I don't think you're going to appreciate that, because I actually had 4 of my clients that happened to them. So what happened was, you have to understand, our clients follow strict rules. So we're very strict when it comes to what they need to do. When the COVID hit, because a lot of them wanted to open, we came up with the strictest rules that you've never heard of. So one rule was 1 employee is allowed to go in the break room. So every staff member had to eat outside. We didn't do the 6 feet social distancing. Within 6 feet you could eat. We was completely like 1 person in the break room. If you want to warm up your food, 1 person is allowed. So what happened, and one example I'll give you, is that one staff member, this is Friday. So on Friday, 4 staff members got together, went in the break room, even though they weren't supposed to. They ate together, each other's food, shared drinks. Crazy. Like, I don't know who would do that. Then one of them had it, didn't know. So on Sunday, all 4 of them called the office manager saying that they got it. On Wednesday, the office manager called me having a heart attack, literally, saying the Department of Health called her and wanted to have some questions for her. So all I said is just talk about everything that you're doing, all the protocols that we have. So they just interviewed them, went over everything, all the things, which I'm going to tell you what these things are. So in a second, what you guys need to do. So they went over the protocols, and the Department of Health says, great job, continue. You know, if they weren't following protocols, the Department of Health will shut you down, and then you will stay shut down until you implement all the protocols, which I'm going to go over with you in about 10 minutes. Okay, just hold your questions. I know you have questions. What do you need to do? I will go over it. I swear to God, I'll tell you everything. Okay, I'm not going to hold anything back. Can I answer? There's another question. Can I ask a patient for a test of negative COVID, even if they had? You can. So here's the thing: if you get COVID, you get tested, you test positive. Some doctors don't retest. They say after 2 weeks you're good. My family doctors retest, just so you know. Okay? You can ask both your employees and your patients to go get retested before you bring them back in. Okay? That's totally fine. It's not against any rules. With COVID, there are no rules. If the more strict you go, you can. I mean, I have a client that got the test, and she's doing the test before she treats the patient. So, and believe it or not, she told me like she had like 4 or 5 people who tested positive in her office. It's like wild. So you can't do whatever you feel like you want to do that. So my protocol, or our protocol for staff, is if they get COVID, they go get tested, they test positive, they go home for 2 weeks, they need to get retested before they come back to work. So that's our protocol, that's our policy of safety compliance experts for our clients. And then if the employee doesn't like it, they can call us and argue with us about that. So because we take this very seriously, we do not want anyone to get sick. That's why we have all these strict protocols, you know, where I'm going over it with you in the slide. So you need to make sure, you know, be familiar with the flu symptoms. It's fever, cough, sore throat, runny nose, or stuffy nose, muscle aches, body aches, headaches, fatigue. So some people might have diarrhea or vomiting. These are exact symptoms of COVID, okay? Don't let anyone tell you anything different. CDC changed their mind after 3 months. No, I've been telling people it's the same, similar symptoms. So be familiar with it. If you know anyone that has it, stay away from them. Number one reason that your staff and yourself get sick at work, okay, is from each other. You don't get it from your patients. So staff are worried about, oh, we're going to have a patient that has COVID. So what? You're wearing personal protective equipment. You're wearing same equipment, personal protective equipment, that a nurse wears in a hospital treating COVID-19 patients. So the reason you get COVID-19 or flu is from each other. You hang out with each other, your staff hang out with each other, you don't listen to rules, you're friends, you're like, I know this guy, okay? If you look back, every time you got a flu, you got it from each other, okay? You didn't get from a patient, okay? So very important to implement these rules. So how can you slow the spread of the flu? Wash your hands regularly with soap and water. Very important, 20 seconds. Do not touch your eyes, your nose, or your mouth before you wash your hands. Very important. Okay, I went over it earlier. Get in the habit of not doing that. If you're sick, don't come to work. If your employees are sick, please. I just, because I'm the same way. I'm sick, I want to go to work. Okay? But because of the pandemic, they're taking things to the next level. You know, they don't want anyone to go to work, especially now. If you're sick, I don't care. You have a cold, until you go get tested and your test is negative, do not come to work. Okay? So it says, would you recommend using hydrofluoric acid spraying in the opera and after? So there are these foggers, which I think the fogging thing you're talking about. I'm very familiar with that. It's good. I like it. If you want to do that, by all means, do it. I mean, I have clients that do that. So I have clients that have the air filtration. I blanked out on it. You know, that filters the air. There's like, then they get the high suction ones. So you can get that, and I do recommend doing the foggers. I really like it. I was actually thinking of buying it for our house. You know, it's just really good. You can, but one thing you have to be careful. You really need to know how to use it, because if that fogger gets on electrical stuff, it could damage it. So just be careful which kind you use and what type of solution you put in it. You know, just be careful, because I know every time they do it, they cover all the electronics. So just be careful. I really like it, just to be honest. Front office, after every hour, the front office would do that. I recommended it, then it was just too complicated. Then I just took it out of the recommendations we had for the clients. And then obviously we schedule any patients that have the flu. The another thing is that's important. I'm not going to spend a lot of time on it. Another problem California has is tuberculosis. California has the highest cases of TB than anywhere else in the U.S. There are more than 5,000 cases. This is back in 2017. They were talking about it. Just be familiar with it. You're not going to catch it. LA County has 95% of these cases. So that's really something to just know. Be familiar with the symptoms. That's all I'm going to talk about. Tuberculosis, some of us, you know, I've been vaccinated for it. I was born in the Middle East. So, you know, most of us have been vaccinated for it, so we don't have to worry about it. So, but if you have coughing that lasts for more than 3 weeks, you know, just be careful with it. You cough up blood. You have chest pain. It's not shortness of breath. This is like genuine pain. Unintentional weight loss, fatigue, fever, night sweats, chills, loss of appetite. Very important. Just be familiar with it, okay? I'm kind of speeding up because I have a lot more to talk about, and I'm kind of like running out of time. So there are 2 other mandatory trainings that you need to go over with your staff. One is egress. That's what to do in case there is an emergency that you need to escape the building. So you have to have specific areas that you go and you meet with your staff. It needs to be in writing. Emergency action plan needs to be in writing for all your practices. Obviously, that's something we give it to our clients. I don't know if you can make your own or how you want to do that. You know, you can make your own if you want. Just needs to be in writing, step by step. Everybody needs to know about it. When you hire new staff, you need to let them know where you guys meet, what's your protocol. Fire prevention, you need to go over where all your fire extinguishers are, where is your IOF station located, because these are safety things. Your staff are not mandated to deal with fire, but they have to call 911. So they call 911, they leave. In case they want to use fire extinguishers, there are videos they can watch. You know, when we go to our clients, we usually go over with them what they need to do. It takes 10 seconds, right? So just you have to have fire extinguishers in the premises, okay? Any questions? All right, no question. Now I'm going to talk about your OSHA updates. So here's the thing. I'm going to go over some stuff with you guys. My goal is to educate you. It's really genuinely, honestly, not to scare you, not to put fear in you. It really is genuine. So those are the things I know and we know as a company based on our experience. I really want to share it with you. So I might go over some, say this is a violation. It's going to be $25,000. So these things that I say is not to scare you, is really to create a little bit of an urgency to really do something about it for yourself. So just want to give you that disclaimer before I do these slides. So now I'm going to talk about, as promised, COVID-19. So what do you need to do? These are not recommendations. These are mandatory things you need to do. You need to call screen your patients. You need to do social distancing amongst your patient and your staff. There are some new posters which I'll show you. You can type it online. You can download it and print it and put it in your operatory. In your break room. There are some new signs that you have to have in front of your door for your patients to let them know about your protocol. So let's talk about call screenings. So ADA has a really good call screening and call log protocols. So as you see here, there are, where's my mouse? There are 2 lines in here. One is pre-appointment. I don't know if you can see it. For me, it's a little blurry. The other one, it says in office. So what is this? What do you do with this? People are confused. I don't know why. So pre-appointment, that's when you're confirming the appointment. You ask all these questions from them, and everything should be known. Okay? Then when they come to your office, you ask these questions from them again. You take their temperature, okay? You write the temperature up here. You write the patient name. You log this in their chart. You want to keep this as a record. God forbid if you ever get Department of Health to come and give you an audit, okay? They will require to see these things. Then you have a daily log. This daily log, you write down all the patient's name, what was coming up, whatever. You keep the daily log there. And then at the end of the day, you store it somewhere to keep it. Another thing is that I think people don't do, you need to do the same form for your employees and yourself. So if I come to your office, you need to do this with me. So if you do it, you come to your office, you need to do it on yourself and do it on your staff. That's something that people don't do because it doesn't say staff screening protocol. You have to have a staff pre-screening protocols because they go through the same thing. You see? So you just need to do that because Department of Health will require to do that. All right? You take their temperature, you log it. You can do your daily screening for your patients and employees on the same thing. You don't have to have a separate thing. All right? You need to have social distancing, 6 feet. This is my recommendation. This is not mandatory for you to do. Our recommendation is don't have patients sit in your waiting room. Have them sit in their car. When you're ready for them, call them up, have them come up. It's always good because that allows you to not get into cross-contamination and things like that. But if you want to, it's okay. Just make sure that the way your waiting room is set up, that you're social distancing 6 feet. Measure it with a tape measure, go 8 feet, whatever, go longer, the better. You know, you want to do that. Department of Health will come and do an inspection if you ever get a random inspection on that. So this is the new poster. It's called Employee Rights, you know, paid sick leave. What the federal government did, they extended the paid sick leave by a week. So that's rather than 1 week, it's 2 weeks. So if anyone has COVID, they get paid sick leave for 2 weeks. This is a poster. Just literally type it up online. And the end of it, if you want it, just email me. I will forward it to you. I have it. So you can totally get anything you want, okay? Just print it in color if you want, or black and white, and post it with the rest of your poster. That needs to be posted. This is something you need to post outside. I think there's a new one. I actually forgot to update this. This is my bad. I apologize. There's a new sign saying, please read before entering, you know, and they added 3 more symptoms in there. So it says if you have fever, cough, shortness of breath, you know, diarrhea or whatever, just don't come in. And then you put your phone number, obviously here, for them to call you. You lock your office so they just can't just randomly walk in. So that's what the protocol is that you want to do. Then you can put another sign if you want to, you know, about social distancing and wearing masks and things like that. That's something you could do. But this is the main one, to make sure that you also let them know before they come in, you know, to, you know, otherwise you expose yourself. So then we're done with that. I'm going to talk to you a little bit about OSHA. So because I have 10 minutes, I'm just going to go review this. Wondering, what does OSHA do? What are the chances of them coming in and seeing you? So number one reason is imminent danger. They see something that's dangerous, or they get a report of an imminent danger, serious accident, something serious happened. You know, they will come do a random inspection. Number one reason that I've seen right now that they do an inspection of someone's office is employee complaints. So you have a disgruntled employee, goes and reports them, and I promise you, every time you fire someone, they probably report you because they know about this. So you just want to be careful. The reason I say this to you, not to scare you about it, it's really just try to part with your employees in good terms. I know that dental offices have high staff turnovers. I've owned dental offices. I've ran dental offices personally myself. Just part in good ways. It's not worth the headache. Okay. And then another thing that's new that used to never be around is agency referral. So if the Department of Health does an inspection, they're not going to fine you. What they'll do is give you a recommendation you need to fix, or if it's really bad, they'll shut you down for a few days or whatever. But what they do, they'll report you to OSHA. Then OSHA is going to come to your office. Or if you have Delta insurance, they come in, how they audit you. If they see it's really bad, they'll report you to OSHA. Okay. So, and then you have targeted inspections. They're so busy. I can, at the end of this slide, Mena, I will give you my personal information because I need your email to be able to send it to you, or maybe I can send it to the association, and the association can send it to everybody. Anyways, targeted, and at the end of it, I'll give you my email. Email me. I will send it because I don't have your information because I don't want to promise you and then I don't do it. Targeted inspections never happen. They're so busy, you don't have to worry about. And then you have follow-up inspection. So when you do get inspected, if there's anything they need to you need to fix, sometimes they come back and do a follow-up inspection. These are just regular stuff I want to go over with you. I'll go over it really fast. If you have regular violations are okay. I will do that. No problem. I will send it to the association and they can forward it to you. Failing to post required posters and failing to obtain permits. For example, one thing is happening a lot is the Department of Health is inspecting your X-ray machines, right? Your X-ray machines are doing inspections, making sure you have the proper permits, proper things, and whatever. So, don't panic about it. It's okay. You just give you a list of things you need, and you just fix it. Failing to train new employees on injury and illness prevention programs. So if you don't do your bloodborne pathogens training once a year, they could fine you up to $13,000. Not reporting serious injuries. You shouldn't have any serious injuries, so don't worry about it. Some of the serious ones that happens all the time: not doing bloodborne pathogens, not having your Hep B vaccination records, prevent. Not having your safety data sheets available, which I'll tell you what that is. You could get fined up to $25,000. You don't have to move my camera, just leave it there. It's not important. Willful violations are mainly if you're doing things willfully. You're just knowingly not doing something. Like you're supposed to have trainings, or you're supposed to have your sharps containers in the operatory, and you're not doing that. They will fine you up to this. Repeated violations and failure to abate, they could charge you up to $15,000 a day. Just so you know, hopefully none of you had OSHA inspections. What they do, they interview all your employees without you being in the room. So that's why you want to make sure you have everything set up to go. Okay, good. Hazardous communication program. So this is important. I know I'm kind of like running out of time, but there's a lot of like new updates. So in 2015, things changed. So in 2015, back in the day, you used to have MSDS, Material Safety Data Sheet. Remember that? That's no good anymore. They changed it to Safety Data Sheet. The format of the information of the MSDS changed. So you have to update the safety data sheets of all your chemicals. You need a chemical inventory table of list of all the chemicals that you have. Distilled water is a chemical. Toothpaste is a chemical. Mouthwash. Anything that you would swallow and be like, oh my God, what's going to happen to me? You need to be very, very careful with that. And you need to have the safety data sheets. You have to have it printed. It has to be in hand. in a manual like this at hand with all your employees, knowing where they're located. This is what changed. They switched to a global harmonized system. If you remember, there used to, let me show it. Let me see if I have it here. I don't have it here. I don't feel like getting it. So there used to be a little, a square with like 3 colors, red, blue, yellow, and white. Remember that? So that switched to this. So rather than, so if it's a health hazard, rather than like writing number 2 in blue, they just put this symbol here saying it's a health hazard. If it's flammable, they put pictures. So they went with more of a pictorial thing. This has been around. It's not just United States. This is worldwide communication program. So you guys need to be familiar with it. I'm training you about it right now. You have to have this poster there. So this is something that we provide for you with Herald. Safety data sheets, I already went over this. You need a chemical inventory table. You have to have your your safety data sheets printed, and all employees need to know where they're located. Another thing that's a new regulation is a workplace violence. There's 4 types of violence: is criminal intent, patient to or a client to employee, worker to worker, or domestic violence. Criminal intent: somebody comes in your office with a gun. Patient throws a stapler, bag, something at your employees. Worker to worker, they get into a fist fight. Domestic violence, they get your employee gets in a fight at home, then the husband or wife brings the fight to work. You just have to have a proper form for this specific thing to fill out, to make sure your employee wasn't traumatized, things like that. This is Cal OSHA also. Another thing, I'm almost done. Another thing which is important, you have to have an ergonomics program. The ergonomics program talks about how you sit down, how you have your office set up. This is one of the major things that really everybody is violating, because it's just almost impossible to be 100% ergonomically friendly. If you want to take a screenshot of this slide, this should help you. Obviously, your screen has to be right. Make sure when you're typing, you're not typing like this. You have, arm rests, and you're resting, your arms. When you're sitting in the back, make sure your back, as it shows in this picture, is straight, or this is a good picture. But the major victims of the ergonomics or this is actually dentists, because of the way you guys operate. As you see in this picture, most doctors do this, right? Because they've been in practice for such a long time, and it messes up your nerves in the back, and you have to, it's going to be hard for you to do that. So this is the recommendation of how you sit. So I like to go over it. This is just me going over it. Just these are the points that you need to make sure. Relax your shoulders, straighten your back. Make sure you have good circulation in your room. Okay, no problem. I'll do it. I think I'm almost done. But healthy hip and knee joints, just make sure you follow. This is pretty good, kind of like a good slide. This is your dental ergonomic program. This is something that we include in your thing. So I can answer any questions. I just want to go over a few different things that I didn't go over here, because it's somewhat borderline, mandatory, but it's not. You need to have cough shields. I'll show you what those are. Okay, what I'm showing you, I just literally typed it up on Google. Fill it up, just brought it up for you. Something like this, you have to have. So wherever you're talking in front of a patient, so in your reception area, you have to have it, okay? In your consult room, you have to have it. So wherever you're sitting in front of a patient within a 6 feet, you have to have this, okay? I know they're annoying and it's just expensive. Just find the one that works best for you, all right? You have to have something like this to basically follow Cal OSHA protocols. Department of Health requires it. Just do that. And then also your front office staff need to cover their face. So they don't have to wear masks. They can just wear regular cloth masks on their face. That's okay. They don't have to wear lab coats. Another thing that's important is the cross-contamination. Try not to walk around during, especially more important during a pandemic, with your personal protective equipment, lab coats and stuff in the back and the front, going in the reception area, walking the patient. Set up protocols that you can take off your lab coats before you go to the waiting room or before you go to your office. These are very important. Obviously, there's a lot of different things. I mean, when we go in an office, there's 370 points that we look at. We look at your electrical, your plugs, your walls, lights, and go into every, drawer and cupboard and cabinet that you have. We look inside everything. You need to make sure your secondary containers are labeled, whatever it's inside it. That's something we do. So just try to use things in their original container. There's a lot of posters and signs and things you need to have on your walls and your doors and all these kind of stuff. There's a lot to go over. It's going to take me, if I want to go over all these things, it's going to take me 6-7 hours to go over everything. So I feel like I went over some of the important stuff with you. I really hope that you got something out of it. My intention, as always, is to really help. If you have any questions, feel free to email me, call me. That number right there is my personal cell. Call me, ask me questions. Whatever it is that you have questions on. If you want to get, I told them in the beginning to the Indian Dental Society that we can deliver a complimentary OSHA walkthrough for all your members. We come in, we just tell you everything you need to fix. If you ever want to work with us, great. Again, I'm totally okay with it. If you want to do it yourself, fantastic. I remember Doctor asked the cost of it. The cost, we're a subscription model, top of the business. We charge somewhere around $85 up to $300, depending on the size of the practice. We give you all your OSHA manuals, the signs, everything that you need that involves OSHA, we give you. And then on top of it, you have a guarantee. So if ever OSHA comes, gives you a fine for something that we didn't find, we cover that for you. So, that's to just show that we know what we're doing. We have confidence in our work. But again, I said it before, I say it again, honestly, any questions, it doesn't matter. You're going to be our client, not be our client. It doesn't matter to me. If I can help you, assist you, be of service in any way, let me know. It would be my pleasure and my honor to work with you guys and help you guys with anything. And with that said, I am done. Right on time.
Thank you very much, Mr. Ranama. You gave us so many tips and a lot of information. We do appreciate that. It was a great presentation. And we're going to close it up, and you will get 2 units. We will see you all during our next session. That's going to be session number 6. You have a wonderful, wonderful week. Thanks a lot.